Thanks, Ron. Good morning or afternoon to everyone. Tough act to follow, Manu. I am here to talk about how Redis can help with building patient-centered healthcare applications, and specifically with Redis Enterprise. My name is Henry Tam. I'm the Principal Solutions Marketing Manager for Redis. And my main job is really to help our customers really take the best advantage of what Redis can do, and specifically in different industries. And today, here to talk obviously about healthcare and life sciences. So with that, let me kind of launch into my presentation. Quick agenda. I'm going to quickly talk about Redis and Redis Enterprise, some specific use cases that we feel Redis can help address in healthcare, and then a little more detail into some specific solutions that our customers have adopted, and then some actual customer stories at the end if we have time. So many of you, I'm sure, know about Redis. Redis is open source caching and database that is in memory. We've been around for 10 plus years now, and I think it's been widely used. I would say primarily previously in the caching centric applications, but we've expanded over the years. And we've taken a lot of the learnings from building our managed service and layering in a lot of what we call enterprise capabilities on top of the Redis open source. So Redis Enterprise is really layering things like linear scalability, high availability, durability, something we call active geo distribution. Tier memory access is really about not only just using memory, but the potential to use things like flash disks and NVMe drives for some of the what we call coder elements that may not necessarily need to be accessed as frequently. Multi-tenancy, consistency, and of course, security. All these things can be done on open source, but by building in some of these things pre-built into our managed service, it just gives you that, frees up your developers, quite honestly, from having to manage all these open source capabilities and being able to then just leverage Redis fully without having to worry about the management and operational aspects of Redis. And of course, we support all the same core data sets, core data structures, and layer in some additional capabilities around different data models and capabilities that lives on top of the open source. And I'll talk to some of these in a little bit. But just as an example, we have a native JSON model, so you can store JSON documents and have access to those documents at the sub-millisecond latency that you expect from an in-memory cache system. So let me turn quickly then to the specific use cases in healthcare, both from the payer side as well as from the provider side. And some of these span both areas, and some are more specific to the payer, and some are more specific to provider. So where we see Redis being used in healthcare that spans both payer and provider are things like, storing patient profiles, authentication. For like most industries going through digital transformation, mobile apps is a key part of the digital front door, and how I think both the payer and the providers can give a much better customer experience, because quite frankly, we're expecting in all aspects of our lives to get the same experience we do, when we're doing a mobile banking application, or things like submitting a claim to your insurance company. Member 360 portals from the provider side is obviously critical to access some of your patient information. And so all these things are made better and definitely made more responsive by using Redis. I'll cover analytics and dashboards in a while in some of my use solutions. I'll talk about how Redis ties into a lot of the things that Mamoon talked about from an AI perspective and where Redis fits there. I won't go too deep into there because I think we had other sessions around Redis AI and ML. I definitely encourage you to listen to those on-demand sessions from previous Angelbeat webinars. So with that, let me go into a couple of the key use cases and solutions that we work on. So one of them is obviously related to the vast amounts of data that's there. I think Mamoon talked about it as well. But how do we integrate some of these data that lives in different siloed databases? How do we tackle the vast amounts of data that's being generated and all the different types of data? We talked a lot about, it's not just text data, and it's not just about, but there's things like, video and images. There's audio data, like when you call in to your virtual, health assistant or virtual doctor, those are recorded, and how do we glean information from that? There is obviously multiple workflows and processes that are specific to the healthcare industry, and all of those are dependent on data. One specific area I want to talk about that we can help to improve patient outcomes and do it more cost effectively is all the care transitions that happen in the lives of most people as they go through their healthcare system, right? There's in-home clinical care. There's, when you reach a certain age, there's senior community care. There's chronic care for chronic conditions. There was one stat that from a large provider, I think it was United Healthcare, that they have grown in the last 3 years to go from 6 million to 12 million per year of care transitions. So that's a tremendous amount of data that is generated from these care transitions. And where does Redis fit in all of that? And how do we help solve the silo and legacy and traditional databases and the different areas that these are stored in? How do we handle all the different and getting access to all those data sets that are being generated? And more importantly, from a cost and efficiency perspective, how do we drive better efficiencies to these multiple workloads? So in the area around things like readmission risk, how do a provider analyze and predict where a patient may end up having to come back because of potential things that were missed during the initial diagnosis? So, and what are all the data sets you need to do that, right? You need to be able to obviously get all the health records, patient profiles, what were the medications that were given to this particular patient, procedures, what were previous diagnoses. During the discharge, what were the follow-up care instructions that were given? How do we plan on specific dietary restrictions or recommendations? And then I think there was some discussion about, Rhonda, you said about wearing a shirt that would give you all the information. I think that's obviously, coming probably, if not, or someone's already working on it, but all the wearable sensor data that provides your Apple Watch that can give you heart rate, your sleep patterns, activity levels. I mean, all these things have to feed into some way to then analyze and predict some of these risks. And that's where Redis helps, right? Because we're able to consolidate on Redis, and because we're in memory, we're able to serve and process the data in sub-millisecond speeds. And so be able to search and store and search that data with using some of our Redis search capabilities. Some of that information may reside as a JSON document, think your fire records. And so we can help as part of that AI ML model for predicting some of these risks. We can act as the online feature store, right, to serve those features that would then help in the production environment of doing the actual inferencing. And then on top of that, we can then tie into some sort of alerting system, which could send a real-time alert, not only to potentially the care manager at the provider level, but at some point you could actually think about sending alerts directly to the patient itself. And all of those things are obviously real-time, because if there is some sort of alert or thing that you want to send, you want to be able to send that as quickly as possible without it, waiting for some sort of batch process to happen, right? And of course, being able to feed a lot of that information into some sort of dashboard, again, for both doctors and providers to be able to then look at trends, things that are, that we're seeing across a bigger spectrum of data across all patients, for example, in that same area. So these are some of the things that, Redis, as I said, is ideally suited for both the speed, the linear scalability we talked about, the availability that we provide to make sure that this system and this way to predict risks are always available so that the patients is the number one care. And be able to offload from some of these, let's say, traditional legacy databases that are not able to handle some of the speed and scale and latency requirements that some of these analytics are predicated upon. And then lastly, from a cost reduction perspective, the ability for Redis Enterprise with its multiple data models to be able to support multiple use cases, both search, JSON. We have a log data structure called Redis Streams that can then process events and data in real time. So being able to leverage Redis as that kind of one consolidated real-time data platform can also help to reduce costs and, of course, improve some of these workflows that most providers are burdened with.
Hey, Henry?
Yes.
One of the questions that came up concerned performance. Given it's a memory-based storage system, how does Redis deal with latency, access, cost, and said more performance issues with some of these healthcare-related applications?
Right, exactly. And so I think that's the main point I'm trying to make. Because Redis is an in-memory architecture-based solution, storing some of this data, and again, I talked earlier about being able to use also things like flash disk. So there may be some data that is suitable to live more on a flash drive. But for your really critical data, and typically what we've seen is that people load in more the frequent data or the more recent data is probably more relevant versus maybe having 20 years of records. But being able to take and put it in memory does give us that performance advantage that a disk-based database is not going to provide, or let's say a SQL database. Any of those things are probably fine for most transactions, but really when you're really looking at something where you need to analyze some sort of real-time data, something that just occurred recently and that you need to make some sort of decision on in the most optimal manner, I think storing it in memory and doing that, either that search or that analysis based on that data in memory that we can serve to some sort of real-time AI ML model to help doctors. I think that's the key. And because it's in memory, again, I think that's how we can provide that low latency that is required in some of these use cases. And so I don't know if that helped answer the question, Ron.
Yes, I believe so. Very appropriate. The other thing I just want to chime in on is, as any of you are looking at all these solutions, generative AI from AWS, other solutions that Ivo is going to talk about shortly, the important thing you want to keep in mind is taking advantage of the overall architecture, your database architecture, your storage, your backup. Let me just unmute, and hopefully I'm going to pronounce this right, Udikishore. And Udikishore, if I mispronounce your name, just blame it on my New York accent. But if there's any other questions you have for Henry, why don't you ask them now?
No, I think he did touch base on the topics that what I was kind of thinking about it. Yeah, thank you though.
You're welcome.
Okay. Awesome. If nothing else, let me move on because I want to be cognizant about time. The other key use case that we see a lot of our customers adopt is, I talked about earlier, are these kind of patient and member 360 portals. This is kind of, I would say, our bread and butter use case because digital transformation is happening across all industries. And I talked a little bit about, customer centricity around how patient outcomes is key. And patients, and certainly I can use myself as an example. When I'm looking at my insurance website, or I'm going to my mobile application, I have the same expectations that I do when I'm looking at my, banking data, or when I'm, doing whatever application that I'm using for work. And that's, I expect, basically a real-time response, meaning I expect to be able to see, if I made a change to something, or I just submitted a claim, I want to be able to see where it's at, like right now. And the portal is my front door to that type of data information. Or if, there's been a change in medication, or any of these things where I want to know kind of right now, because, we all live busy lives, right? And healthcare should be our top concern. And again, this improves the whole patient experience. And I would argue it's part of patient retention from a provider perspective. And then from a payer perspective, if you're a insurance company, whether you're Blue Cross Blue Shield, or whether United Healthcare, or whichever ones that most people use, I think there's some stat that says that 15% of all costs related to patient care is related to administration costs. And part of administration costs is things like not answering questions through the phone. And if you can get that data and that information through your 360 portal, or your member portal, or your payer portal, then that helps reduce some of those costs for your customers. And then, of course, being able to do things like authentication, storing the session data, all the I would like to call that the bread and butter use cases that Redis has been used for, equally apply in this case for this particular mobile app. Because if you think about it, this portal, whether it's a website or you're going to a mobile application, has the similar requirements and the similar capabilities that Redis provides that we've done for many other industries, and it should definitely be considered for use as part of, again, mobile application, or your desktop website 360 portal. So this one particular customer that I'll mention was shifting to microservices and using the cloud, and really their issue was that they used a lot of relational databases, and they really weren't designed for real-time access. And more importantly, they were all the type of data that needs to be consolidated and accessed by a patient or a member, are living in different siloed databases, as I mentioned earlier. And one way to kind of consolidate and provide that 360 view is to store some of that information in Redis, to then be able to provide it through that portal in a much more low latency way. And so the benefits were those profiles and sessions gave them responsive, fast, and scalable logins, self-service tasks that may be happening through that portal, things like scheduling appointments, or, like I said, checking on the status of claims. And again, because we support multiple data models and data types, it gives you the same platform to store all these different types of data natively within Redis. And I mentioned active geo-replication, and that gives you that 5 nines availability, so you avoid the downtime, because like me, if I'm accessing at 2 a.m. in the morning versus 8 a.m., I want it to always be available whenever I access that portal. Now, one of the things that I also want to highlight, which is core to Redis, and I showed this in my earlier what is Redis and what is Redis Enterprise, is some of the different core data structures that Redis provides. And a very basic one that I think is overlooked that I wanted to just quickly highlight is sorted sets. Because as in the gaming industry, where you think of things like leaderboards, there are actually ranked lists happening in many industries. And within healthcare, think about what are the top procedures, who are the top payers, what is the top symptoms. All of these things are, definitely think of it as a ranked order list of sets of data. And sorted sets is a perfect native data type within Redis that will easily, at the time of ingest, sort it into the right order. and provide you with that top, whatever it is, list that is relevant to your particular area within healthcare. And so I just wanted to call that out as that people, when they think of, leaderboard, they think of things like games, but really it applies in the healthcare industry as well. And being able to provide that in a very quick manner, I think is will also help in some of those administrative costs as well. The other area that I wanted to cover was more around dashboards and analytics. And I'm going to save the data similarity for, I have another dedicated slide to talk about that. But things like search of CPT codes, storing your FHIR messages and records in JSON. In your dashboard, when you're looking for some sort of trend analysis using our time series model to track either changes or some sort of trend over time and providing that to either to the doctors or to the providers, I think is key. Vector similarity is what I'm going to talk about next, because I think this ties directly to the what Moon was talking about earlier about things like X-rays and images feeding it, being fed into your AI models. One of the things that Redis does as far as search is we also can do things like vector similarity search. And I'm sure, if you listen to our AI discussion in previous Angelbeat, vectors and embeddings, you need to translate non-structured data like an image or an X-ray into a numerical representation and feed it to some sort of model to convert it into what we call an embedding or a vector embedding. And so once you have that, you're able to then do things like compare and find similar images from one, let's say, X-ray to another set of X-rays based on that numerical or vector embedding. And be able to do that across, let's say, millions of images is key. You can compare doctors' notes and audio. So again, converting those notes, that text, and in some cases audio. If you mentioned, remember I mentioned, maybe the recording from some virtual doctor thing that was recorded, and how do I now then compare that data that was captured in that audio recording and in the doctor's notes from one to a different one. For example, if one note said, performed an influenza virus antigen test and patient received a flu shot, how does that compare to a similar note where someone said performed an electrocardiogram to check for signs of heart problems and the patient was also given a flu shot? Are they similar? Are they not similar? And how do you do that across, obviously, think of thousands, if not tens of thousands of those kind of notes that doctors are doing all the time in that health system, for example. So I think this is like another key advantage to Redis that maybe is not as well known, but we do see starting interest, especially because of the whole buzz and generative AI that has happened. Using Redis as a vector database and using us for this vector similarity search has definitely come up a lot more frequently now, and I think is something to consider for part of both your AI and ML modeling as well as for your other workflows. So I'm just going to quickly conclude with a couple of quick customer stories. Ron, if I have time, just real quick. HealthStream is a learning and management system that helps do training for and provide certified training for different types of healthcare workers, whether it's nurses or things of that nature. It's also provides things like scheduling, and it does, and the healthcare providers that access the SaaS provider wants to get things like reports. And so by leveraging Redis, they were able to scale their platform as the growth of their online learning. And I just noticed a typo. It should say online learning, not learning. And they were switching from a microservices-based architecture. And they were really concerned with things like availability and reliability. But by implementing Redis, they were able to solve all those challenges and provide much better customer experience for their customers. And the last customer story is from our APAC region. Indonesia healthcare IT provider was originally using MongoDB as their document store. And because of the slow latencies and writes that were happening, they switched to using Redis and specifically our JSON model to store some of their electronic medical records and be able to do search on it, which is more important for them. And by combining both, the latency and high performance that we provide with our search, we were able to give them the best performance and, of course, help their customers directly with that access to those medical data and records. And so with that, I'd like to thank you for your time. And if have any questions, I'm definitely open to answer any more. Of course, you can always contact Redis as well directly.